Before I went to the dentist, I said that my teeth were already perfect enough and they were good, like my mom's. But someone pulled off my tooth with a belt. My teeth said to go ahead. Since he's 11, you can even actually do braces on one jaw on the apple.
Black generally is very inquisitive. I like the fact that he asks open-ended questions and he wants to know. He wants to know everything that you're doing on him. I love that he loves himself first, because if you love yourself, you definitely want to know what are they doing to me. Will the treatment affect me in either way? So, but there are patients who don't actually ask. Everything they know, the doctor knows everything, so he will do whatever he knows what he can do. So most of the treatments, if we discuss with the patient and then we want them involved in the treatment planning.
Okay, what I thought about my teeth is that if I continue sucking, they're going to grow more and it will take even longer to fix them. So I said, okay, let me just ask mommy if she can watch out for a dentist or anybody that contacts her.
Sucking her thumb is okay if she's below 2 years because it's a security to them.
But I need how old.
But you keep telling her.
It's hard to stop.
So now
She can't even suck her thumb. She sucks.
Then that's why it's big. So for that treatment, what we do for our case, we will make for an appliance. You see this one on the wall here?
Yeah.
I can also add an open light. So that they look like that.
When I met Bianca, she was so lively. She's so lively. She's genuine. The patients who lie. She's genuine about herself. She looked to be informed about the problem she had. I think she was seeking for solution. She knew her problem, but she did not know what can be done. Though she had an idea of what kind of treatment can be done, which is good. For me, at my age, at that age, I really did not know about such.
We're back from the kids' first consultation and their teeth are rotten. Kidding. According to Blake, Blake's dental formula, his genes somehow explain his teeth, and then Bianca, her dental formula is because of her habits. So I'm to blame for their teeth. Parenting, guys, parenting. So I gave my son bad teeth. Then my daughter's habits. Oh, that's Bianca's dental formula is her fault. It's not mine.
In your teeth, we'll place the brackets on your teeth. So the brackets are placed on top of your teeth. They do not hurt. So you'll have an opportunity to choose the color of your choice of your rubber bands. Yes, so I'm going to start by taking a few photos of your teeth for your assessment. You had food. You didn't brush. Okay.
I didn't know.
Okay, bite your teeth. First clean off. The cement we are going to use is very sensitive to moisture. If we don't keep saliva away, the cement will not work, so the bucket will not really stick as we want. So we are going to use some light. We call it curing the bond. For a few seconds, and then we'll take it off. So we always place this bracket perpendicular to the long axis of the tooth, which you can call 90 degrees, because we do not want to cause unnecessary movements that we didn't want. The way how we place the bracket matters. If we place them a wrong way, your teeth will also shift in a wrong direction. So they have to be put well. So getting braces is not painful, like you see. There is no pain at all. Now for your case, you might not get any discomfort because you don't have any teeth that are out of line. You only have teeth that are more protruded, they are more in front than the rest. So you might not experience discomfort like other people do, but there might be mild discomfort because you're getting used to them.
When the dentist said that I'm going to get braces, I felt good because I've always wanted braces, glasses. You know those times when I would tell you that my eyes are painful, really, it was real pain. They were real paining. My teeth would pain. I really wanted glasses. I really wanted accessories. And I need to look good. Instead of my parents taking me to an optician, they took me to an ophthalmologist. And ophthalmologist just told me, you need a pen to make my eyes right. So I was like, okay, now it's time for me to win the teeth. My parents won for the eyes, and I won for the teeth. So it's 1-1. There's something else I'm coming for.
Basically, it was just a mild problem. It was a mild problem, just proclination of his teeth. So the treatment was aimed at making sure that we make his teeth go back in the right position. And you know, when you're a child, you know, your smile really matters a lot, because kids at school, they can make a laugh of you when your smile is not good. It can affect their academics, their confidence. So his problem was basically his teeth being proclined, and the aim was retracting them back to the normal position. Proclination, it means the teeth are a bit pushed more forward compared to the normal as it would be. Age matters a lot on the type of treatment somebody receives. If they are still growing and maybe mixed dentition, what we call it, a mixture of both milk and permanent teeth, we can advise appliances. But then when a child clocks that age where the milk teeth have all come out and they are only remaining with the permanent, and the few permanent have not yet come, we can consider to start the braces. Yeah, there are kids who are bloomers. You find the child is 12 or 11, but they have all their baby teeth out. We basically start treatment with braces immediately. We do not have to first do appliances. But then it goes back again to the case, to the problem that they are presenting with. Yes, so if they have narrow jaws, we might need to expand them before we can do any other treatment. And of course, then the appliances will come in. But if it is for the case of Blake, it's just protruded teeth. He's of right age, most of the baby teeth are out. We had to go for the braces.
So she was telling me how she was like, but can't the doctors give me the braces?
Not the braces.
No, can't they test me and then also measure me and then give me the appliance on the same day?
Mommy, I didn't say that.
What did you say?
I said when they're already seeing what happened to me, to my teeth, then they measure me that same day. Then now since it came on Friday, that's when they give me appliance.
So you want the appliance on the same day?
No.
When?
Like after them seeing what happened to my teeth, they measure me that same day.
Oh,
then on Friday.
remember when we did the consult? Is when she wanted you to measure her, so that today she's getting a fitting.
Which one? So remember on Friday we were checking the whole family. So it took time for all of them to be assessed. Okay. And then since you had come in and your appointment time was gone, we did not want to make a queue there. You understand?
Also, it could have been
So
possible.
it would be possible, but we would have more queues there. You understand? So yes, so we don't want people to overweight in the queue. It's like you, when you come, you want an appointment, and then somebody enters in, they spend 2 hours. You'll be complaining. What are they doing?
It's just teeth. Okay, are you ready?
So today, okay, what you were talking about, today we are going to take measurements for your jaws, and then we'll make for you the appliance that we talked about.
So when will I come back to get the appliance?
It will
Mommy will still book.
We'll be in touch with Mommy, but it will be ready by tomorrow.
You want to come tomorrow?
Tomorrow is Saturday, yes.
But tomorrow you're going to the village.
So
Yes, we'll come here and go to the
anytime Mommy is available, you will come.
It will take longer because you said 8 months. So it will take longer for me to add it. Because now it's 8 months, and if I continue, it will be 8 months and let's say like 2 days.
That is still okay. 2 days are not many. You're a timekeeper. At school, you
No,
should,
I'm not a time.
you should start.
Like that time.
You wake up late. What time do you
No.
wake up?
Today was the second for school.
I told you you're a timekeeper.
Yes, but they don't make me the timekeeper. I don't know why.
Yeah, it's good. It's good to manage time. The time is money.
Yes.
Any second you lose, you're losing money.
You, what money are you making?
Man.
You're making money and you bring points.
Oh, yes.
You're making money.
So what do you want to become in the future?
A teeth remover with belts.
A what?
A teeth remover with belts.
That's a
When mommy and daddy's teeth want to come out, I put a belt.
That door,
On the door, I tell my friend, open.
You guys, I was like, Mommy, when are we going? Make the appointment. When is the appointment? I need to go and see the dentist. Mommy made the appointment 2 weeks later. So we went on Sunday for the first appointment, and I told the doctor I was sucking, you know, my teeth went ahead, like those things. Then we finished the second appointment that Mommy made. We went on Friday. He measured my jaw so that we could put the appliance.
Bianca examined, of course, there is history of habits. Most of these malocclusions that we see, basically habits. If it's not genetic, the habits, tucking the thumb, some they're on pacifiers for so long, some are breathing through the mouth. So most of those habits can bring about these deformities. But good enough, she started a bit early. Yeah, so for her, she's in mixed dentition, mixed of both permanent and the mixed teeth. So we could not go for braces immediately. We had to go for appliances first, and then make sure that we curb the problem, because when we are treating, we look at the cause, we don't look at the symptoms. So we had to look at, she had an anterior open bite, so it means the front teeth were not joining together like the normal would be. So because of her thumb sucking, the teeth kept separating apart, the jaws. So the solution would be to first curb what is causing that, is to make sure that she does not suck again. And then the appliance is also aimed at pulling the jaws together so that they can really join and be able to terminate.
They measured my jaw, then we came back on Monday. So Saturday, Sunday, Monday.
Yeah.
You told me to suck the last day, Mommy. Then I had to remind you. Mommy, my jaw will go ahead. And she's like, oh yeah. I was like, it's okay. So I got the appliance. Let me show you how it is. Thank you, Mommy. So it's supposed to be, so when they measured my teeth, they turned it in a material, like it's rock. So this wire is supposed to be on my upper teeth, the ones that moved ahead. This is supposed to be on my side, these ones that are be here, and also these ones. So this is just where my tongue like says there, so let me put it on. Yeah. So it's hard for me to speak, but I can try speaking.
Blake and Bianca, we had to do like an emergency doctor's check because Blake lost the rubber. Is it like, it's like a tie, right? That tie the braces, right? Yeah. So that rubber band, he'd somehow lost it, and so we had to go and get another one.
But not on purpose.
Well, he says it's not on purpose. Obviously, I don't see him plucking his teeth. And then for Bianca, we had to go back because she's playing me, that girl. She's playing me. I see her. She tells me things like, apparently she has wounds in the mouth, and when she puts the braces don't sit well. I mean the appliance doesn't sit well. And so she has switched the positioning of the appliance. But anyway, doctor says it's cool, says it's kawa. And then she pulled out her tooth where it was sitting, where the appliance was sitting. Doctor says it's cool. I'm just like, this girl, Did you talk to the doctor before I went to see the doctor? Anywho, so anyway, we're back. We'll be going back for their first review, official review, on 22nd of this month. So I can't wait to see what the doctor says, see what their dental formula is looking like, and yeah.
So Bianca, you're back again.
Yeah.
So what is the issue today?
So I have two wounds in my mouth because of the way it told me to put it. Then now I put it like here, because every time I put it where it told me, it makes a wound in both sides.
Okay.
Then my tooth fell off.
The baby tooth.
Yeah, it fell off. So it also hurt.
It fell off.
Yeah.
Okay. It's okay. Did you get any pain?
When it fell off, no.
Okay.
You removed it yourself even.
No, I just poured water.
And you refused.
Yeah, I just poured water.
Now here in the dentist. She has her own method of removing teeth.
You poured water? What happened?
Then I like went out.
So, it was cold, it was warm,
What do you mean?
the water.
was-
Was it cold or warm?
I don't know. I did
What was the science behind putting water?
try like make it fall off.
So you're getting it out by pressure, eh?
Yeah. Instead of mommy just pull it off.
So how did you put the water?
I removed this because I was eating biscuits. So I removed and I felt it shaking. So I went to the bathroom, like got water and then stuck my teeth and it fell off.
By all means, it had to come out.
Yeah. The second time I'm doing it.
You must be an innovator. So you're soon innovating another way.
I got wounds from when the doctor, so where the doctor told me to put it on, but I got wounds. 1 week later, I got wounds, so I asked mom to make another appointment, and we made.
Okay, let's first get this out. Open the mouth. Okay. Oh, even the permanent one is almost here. It's almost here. So the reason why the baby tooth was shaking because the permanent one was pushing it out. That's why it was easy to move out. I want to show you the permanent one coming. Yes. So that's okay. They had told me we are sucking again. It is happening.
Mommy, when I forgot to put it on after eating,
That's what you do.
so when I forget, then you remind me, then I put it on.
That's why you're still sucking.
I'm not, mommy. At school.
How about when you finished eating?
That's what I said. I forgot to put it on, mommy. Then you guys remind me.
So usually habits break slowly. It's not a one-time thing.
Okay.
It's like when somebody has an addiction, you're not going to tell somebody stop smoking. They can't stop smoking immediately. So it's a gradual thing. So with time, she'll definitely get rid of the habit. Yeah.
But you do want to continue sucking.
Somehow.
You get pleasure in sucking.
Like I calm down. Yeah, I calm down.
You're sure?
Yeah.
It is water. You use, what do you use? You use soda.
Boiled water. Boiled water.
I thought you.
Bianca, I won't use it.
I thought you.
No.
You use.
Mommy, don't lie to the doctor.
I told the doctor you're using soda.
Doctor, I wasn't using soda. Maybe it's mommy going to use sword.
Mom is really there.
Until you keep shocking us with your new methods. Might be using sword and we are here.
No, I'm not. I'm using boiled water.
Okay, so
I put.
I want to see how you put it on. Give her a mirror. There's a mirror there. That's okay.
Look at that smile of Victoria.
She has made it.
Like,
She's now a pro.
so I said, what are you telling me now? The doctor said it's kawa. How I put it.
You were really
Okay.
Our own doctor, you know, dentist, Dr. Bianca.
Yes. I just need a belt. Then I'll remove your teeth. I told the doctor I have 2 wounds up. He checked them. My tooth fell out. I removed it. So here has nowhere to be seated. So it's hard because it's the metal is seated up there. So it's hurting me. Then I started, before that time, I started putting it in another way where I can try to speak better. But my wounds are not paining and my tooth is not paining. Where my gum, you know. So yeah.
So Blake, how are you today?
Fine.
You're fine? So how is your experience with the braces so far?
Fine.
There is no issue?
It's just this one's out.
Yeah, the tie came out.
I didn't even know it came out because there was one evening after washing my mouth, I went and then I asked Mommy, is there something out of my mouth? Is there something missing? Then she said that there is a brace missing.
It's not a
So I
brace.
got remove.
It's a tie that we used to fix that open coil onto the bracket, the brace.
So is there going to be any day that you're going to remove these and then put different colors?
Definitely, if you choose to.
Yeah. I really need clear ones.
Not on your next appointment. So today, it's a month from the previous appointment. So I'm going to replace this tie that came out. They said you are brushing, or you are trying to brush hard, teeth to be clean.
Yeah, because I'm actually very hard, but I know.
Okay. So this is simple.
The reason I like Uriel Dental Clinic is because I made a friend there. He's an adult, and we even made a handshake with my sister as well. I liked him because he was a good assistant, and the dentist I liked was Dr. Emma. He did everything gently. He didn't hurt my gum. He didn't damage anything. He didn't use so much force because some of my teeth were hurting. And he didn't use so much force. He cleaned well. And yeah, that's why I like him.
Okay.
Thank you.
Thank you, Dr.
You're welcome.
A
And when I meet Bianca, I was so amazed because she did kind of extraction. She explained to us, we are still even wondering. And for break, he's a good guy. We met because he's a football fan, and I'm a football fan. And he's an Arsenal fan, I'm a Liverpool fan, so it was easy to meet and to interact. They are open. I got a chance of moving with break up down there to buy something. He's a kid who is open, who knows the right question to ask, direct, he's not distracted. It is something which is rare at that age.
By the way, if you see Dr. Emma in Benz, the GLE number plate shows Dr. Emma, just know he's the one who worked on my teeth. And you can see his car and you know that, yeah, he's careful. He makes good decisions. He chose the right clinic and he chose everything. Well, he chose the right car. I don't even know where he got all the money from, but it was pretty interesting, like my parents. They're no joke.